And when she got pregnant again, the second time, she, instead of choosing to not have the backup plan, she had the backup plan. So then she could have the VBAC. And there's a lot of really interesting stuff too about reliving trauma. And she got to relive it, but having the VBAC, vaginal birth after cesarean, having the VBAC, she was able to then heal the trauma of that cesarean section. And she actually went on to become, it's called a hypnobirthing therapist. And I thought that was so cool that then she took her experience and she used it to help other women. Postpartum psychosis is very rare. It only occurs 2% of the time. But we should be aware of it if the woman is hearing voices or having hallucinations. And one of the saddest ones is Andrea Yates. It was about 15 years ago. And she killed her 5 children. She drowned them all in the bathtub. And she was hearing voices, and God told her that it was terrible for them to be here, and she was a terrible mother and all of that, and she needed to kill them. That would be the best thing for her to do so they would go to heaven. And so we need to be aware of this because some women, they require immediate medical intervention and they can harm themselves or their children. And so it's very sad because there were lots of signs that she had postpartum depression, but it was ignored until it reached this end. So perinatal mood disorders, like I said, can also occur even a year later. And sometimes women aren't depressed. They're anxious, they're tired, wired, right? They got the whole adrenal thing happening. They're restless and irritable. They can't concentrate, can't remember, right? Baby brain, they can't remember anything. And some women will have persistent physical symptoms, which don't respond very well to treatments. And I have had many women come in with a UTI that then becomes a yeast infection, antibiotics, antifungal, antibiotic, antifungal. The last one I just saw last week, the doctor just gave her the prescription for both at the same time because they knew she's coming back for the antifungal next week anyways. So this is a horrible round and round and round chasing your tail thing. And we need to find the cause of the problem, right? And the cause, the body heals, help them with their gut, help them with their floral balance, help them with their diet. I had one patient, I said, don't eat wheat. It's not good for your body. It's gonna, so she started buying Wonder Bread, white bread. Okay, so sometimes we got, like, I didn't realize I was not communicating very well at that point. So, there are more risks if they've suffered previously, if they have family history, if they have a C-section and they're having trouble recovering from that. Okay, so many different things. There's a lot of hormones, like we talked about, the progesterone that crashes, the oxytocin. If they don't have enough oxytocin, they're not going to bond with the baby. They're not going to have that proper connection to the baby. Having high prolactin levels can actually make you depressed. And then, of course, thyroid, adrenals, testosterone. And the physical things that are happening, the mastitis, the vaginal dryness, pain with intercourse. So I'm going to get into some treatments, but also all the neurochemical changes and the autoimmune disorders. So dietarily, they need to be well hydrated, especially if they're going to be nursing, because dehydration causes depression. Of course, the intestinal flora, the food sensitivities, all this, you guys know all this stuff. And then situational stressors, what's going on in her life. Have that conversation with her. Get deep with people so they can actually tell you how you can help them. And finally, this is my 4-step protocol for perinatal health. So I use bioidentical progesterone if they wish to use it. I also use Vitex, which is an herb, or the yam creams. So whatever they feel open to, I use them. But let me tell you, the progesterone, in a day, when you feel better. It's so fast. And so if I can, if they're really having a severe time, I want them to try it. They can use the, Prometrium generic. The insurance will cover it, 100 to 200 at bedtime. It helps you sleep. It's great. It's micronized. And then they can get sublingual progesterone to use during the day, which doesn't cause drowsiness. Chase tree berry, I do 750 milligrams daily. When I cycle progesterone, I can do it uninterrupted. And now I see women in their 40s and 50s having babies. And so you know, these are women who are going like right into menopause right after postpartum. So they need to be really helped and supported because it can be very difficult for them. So I'm going to do uninterrupted, no cycling. But we can cycle off of the hormones if we want to, you know, mimic what the body naturally does. It sometimes is necessary for women in order for them to have a period. Some women won't menstruate unless you cycle them off. But the cycling, I don't go day 1 through 10 or this or that. I'm going with the person and what's going on with them. Because if she gets really bad headaches right when her period starts, I'm going to take her off the progesterone, then leave her on the progesterone, and then maybe towards the end of the cycle she might take some time off then. Testosterone is great for the incontinence, for sexual function, and we can help restore that, strengthen that part of their body just with a little tiny pea-sized amount of testosterone cream. If they have vaginal dryness, add the estriol cream to it. I mean, you can keep women from having to go have this horrible sling surgery to sling up their bladder and sling up their rectum by just using this little tiny drop of cream every day. And let me tell you what, you use it over time, the body remembers what it's supposed to do. The body knows what to do. You're just like T3, right? You're just helping it remember. And it remembers, and then maybe they use it once a day, then every 2 or 3 days. Then once, I have lots of women in their 70s, and they have horrible incontinence, they're wearing diapers, and now they just use their little cream once a week. They can have sexual relationships again, they feel younger, they feel happier. I mean, nobody's gonna be happy if you're peeing your pants every time you laugh, right? It's not fun. So we want to help empower them, and what a simple way to do that. If they have a yeast infection after you use the estriol, because sometimes when you get their vaginal lubrication again, then use a probiotic. I just have them insert a probiotic. So I'm going to skip through the testosterone mostly, but I just want you to think about testosterone for women with really bad postpartum, especially if they have the libido and the low energy and that part of the picture, because I've used it with women in their 30s, and it's tremendous for healing the postpartum issues. Lots of benefits of testosterone. Of course, we want to get their thyroid optimized, and we can't use T3 therapy when they're nursing because it crosses into the breast milk. So just remember, you have to wait. There's a lot of herbs too that we don't use when they're nursing, but that's in my book too, all those different herbs. Let me see where I am. All right, so let's talk about the adrenals, tired, wired, the sleep disturbance, again, things that you can't use when they're nursing, ashwagandha, licorice. And I always use really low doses if I'm doing vitamins and glandulars if they're still nursing. And I love